Hello, my name is Calum Morrow, and I'm an anaesthetics senior house officer at the Mater Misericordiae University Hospital in Dublin, Ireland. Peripheral nerve blocks are well recognised for reducing post-operative opioid and antiemetic requirements. They have been shown to aid enhanced recovery, especially regarding pain after orthopaedic procedures. However, our perception was that their use within our department was varied. This audit aimed to evaluate current utilisation of peripheral nerve blocks in orthopaedic surgery and, by circulating a short survey to our consultant anaesthetists, identifying the main barriers preventing their wider implementation. This audit took place over a 3-month period between November of 2024 and January 2025. So, when looking at the results for audit, 72 out of 260 orthopaedic patients received a peripheral nerve block. The most blocked procedures in the upper limb was the distal radius repair with 31.6% receiving a block, and in the lower limb it was the neck of femur repair with 48.1% receiving a block. In the graph below you can see the proportion of lower limb procedures where a peripheral nerve block is performed, the most being with nearly 50% of hip/femur procedures receiving a block with 25 out of 55. In the graphs on the right hand side here, you'll see in the top the upper limb peripheral nerve block choice was the auxiliary approach to the brachial plexus block was the most popular with 52%, and in the lower limb it was the fasciolae and femoral blocks that combined over 50%, which, given that the significant portion of femur/hip procedures which received a block, is not surprising. When we look at the results of our survey, on the left the main barriers to performing peripheral nerve blocks were surgeon preference against, lack of training and confidence, and time constraints. When looking at ways on the right hand side of overcoming these barriers, highlighted solutions were less time pressure, a designated daily regional anaesthesia consultant, and more ultrasound machines and peer support. This audit has highlighted that while peripheral nerve blocks are recognised as viable tools to help improve patients' post-operative experiences, their implementation is varied. Our survey showed that barriers to performing peripheral nerve blocks are mixed, but improved multidisciplinary collaboration, further funding for equipment and training opportunities are potential stepping stones for advancing patients' outcomes post-operatively. Thank you.